The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the first surgical clinic of the General University Hospital. Basic bandaging techniques. Principles of working with a bandage. A properly applied bandage should be effective, economical, and neat. Stand facing the patient and communicate with them while applying the bandage. The width of the bandage is selected based on the injured area of the body. The bandage is unrolled from the palm, starting and ending with a circular turn. The first turn is secured with a so-called lock, where the caudal end is fixed with a circular turn to prevent slipping and ensure firmness. We bandage from narrow to wide, towards the heart. For finger bandaging, we begin at the wrist and work our way to the fingers. We do not tighten the bandage too much, nor do we leave it too loose. Regularly check the application site for paleness, swelling, circulation issues, and monitor capillary refill. The wound must be covered with a sterile dressing, which should extend beyond the edges of the wound. Once placed on the wound, the dressing should not be moved to prevent infection. Pressure bandage. A pressure bandage is a universal method that stops most venous and arterial bleeding. The rescuer covers the wound with a sterile bandage. If blood seeps through the applied bandage, the original bandage must never be removed, but an additional one must be applied. Spica sheath bandage. The bandage pattern resembles the appearance of a wheat sheaf. The bandage starts with two circular turns and then ascends in a rising sheaf pattern, forming figure 8 loops toward the center of the body. If the direction is reversed, it is called a descending sheaf bandage. Shaving bandage. This bandage is applied in a spiral manner, with turns overlapping by about 1/3 of the bandage width. Its appearance resembles a wood shaving. If the bandage starts at the periphery of the limb and moves toward the center of the body, it is called a rising shaving bandage. If the bandage is applied in the opposite direction, it is called a descending shaving bandage. The shaving bandage, known as Dolabra curans, is used for limb bandaging. Layered bandage. It provides better compression and holds more securely. The overlapping bandage, Dolabra reversa, is primarily used on limbs with uneven diameters along their length. For instance, the forearm or calf. While turning, the edge of the bandage is secured by the thumb of the opposite hand. The head of the bandage rotates 180 degrees. The bandage continues to wrap circularly around the injured limb until it reaches the point of the first fold. Each new turn partially overlaps the previous one and is directed closer to the body's center. Figure 8 bandage. Figure 8 bandages are made of two loops that intersect at a single point, taking the shape of the number 8. By combining several figure 8 turns, which partially cover the previous turns, This results in sturdy bandages mainly used for joint stabilization. If the intersection point is on the side of the extensors, it forms a sheath bandage, pica method. If the intersection point is on the side of the flexors, it forms a turtle bandage which diverges in an inverted pattern. Reverse diverging. The positioning of the body parts being bandaged must be definitive from the start and should not change while applying the bandage. Otherwise, the bandage may bunch up, which can cause pressure. Tubular bandage. We primarily use the universal paja fixation bandage for wound dressing, known for its softness and breathability. It can be used for all kinds of fixations, especially in joint areas or on conical and rounded body parts. To extend the durability of the bandage, we can use a tubular covering bandage. It is designed for the quick fixation of wound dressings on any part of the body. It is highly elastic with wide mesh, firmly securing dressings even during extreme movements and adapting to the body's shape. Does not constrict, fold, overstretch, or irritate the skin. Available in multiple lengths, sizes, and shapes. Circular bandage is used for smaller wounds. Created by wrapping multiple overlapping turns in the same location. To make it, we cut a strip of bandage approximately 120 centimeters long. We cut or tear both ends in half towards the middle. The middle part remains intact, about 10 centimeters long. We tie the strips into a knot, forming a pocket with the middle section. The sling bandage is used on the chin, nose, or scrotum. Coban elastic self-adhesive bandage is adhesive, self-fixing, and provides consistent, even pressure. This bandage is used for securing bandages, medical devices, or increasing compression. Before application, unroll about 30 centimeters to release tension. Apply without overstretching, using only the necessary tension to achieve the desired compression. Fixes using a Velcro-like principle, allowing for easy finishing. The crepe texture provides cohesion, requiring only a few turns for secure fixation. Ends are simply pressed down to hold the bandage in place. After application, cut off the excess bandage and press it firmly to secure.